Conduct disorder is classified in the 4th edition of Diagnostic and Statistical Manual of Mental Disorder, or DSM. It is diagnosed based on prolonged pattern of antisocial behavior, such as serious violation of laws and social norms and rules in people younger than the age of 18. Similar criteria are used in those over the age of 18 for the diagnosis of antisocial personality disorder. No proposed revision for the main criteria of conduct disorder exists in the DSM-5. There is a recommendation by the work group to add an additional specifier for callous and unemotional traits according to DSM-5 criteria for conduct disorder. There are 4 categories that could be present in the child behaviors: aggression to people and animals, destruction of property, deceitfulness or theft, and serious violation of rules. Almost all adolescents who have a substance use disorder have conduct disorder-like traits, but after successful treatment of the substance use disorder, about half of these adolescents no longer display conduct disorder-like symptoms. Therefore, it is important to exclude a substance-induced cause and instead address the substance use disorder prior to making a psychiatric diagnosis of conduct disorder.
Other diagnoses that are within the same category are oppositional defiant disorder, intermittent explosive disorder, antisocial personality disorder, pyromania, and kleptomania. So let's talk about what is oppositional defiant disorder. Oppositional defiant disorder, or ODD, is a childhood behavioral problem characterized by constant disobedience and hostility. The quality of parenting seems to be an important factor in the development of ODD. Treatment options include parent management training and family therapy. Can you grow out of oppositional defiant disorder? Children cannot grow out of oppositional defiant disorder, ODD. In fact, ODD that is not properly treated during childhood can worsen behavioral problems as the child ages. However, with proper treatment, children and their parents can learn to live with the symptoms of ODD. What is intermittent explosive disorder? Intermittent explosive disorder, sometimes abbreviated as IED, is a behavioral disorder characterized by explosive outbursts of anger and violence, often to the point of rage, that are disproportionate to the situation at hand, e.g., impulsive screaming triggered by relatively inconsequential events. What causes IED disorder? Intermittent explosive disorder, or IED, is an impulse control disorder that is characterized by sudden, unwarranted episodes of anger. This disorder causes people to act in a hostile manner or impulsively participate in recurrent aggressive outbursts. Antisocial personality disorder. What is antisocial personality disorder? Antisocial personality disorder is a particularly challenging type of personality disorder characterized by impulsive, irresponsible, and often criminal behavior. Someone with antisocial personality disorder will typically be manipulative, deceitful, and reckless, and won't care for other people's feelings. Antisocial personality disorder signs and symptoms may include 1. Disregard for right and wrong. 2. Persistent lying or deceit to exploit others. 3. Being callous, cynical, and disrespectful of others. 4. Using charm or wit to manipulate others for personal gain or personal pleasure. Pyromania. What is pyromania? Pyromania is a rare, pathological disorder characterized by intentional and repeated fire setting. People with pyromania are deeply fascinated by fire and related paraphernalia. They cannot stop their impulse to set fires, may participate in other fire-related activities, and experience feelings of satisfaction or a release of built-up inner tension or anxiety once a fire is set. Pyromania can affect adolescents and adults, and is more common in males than in females, though it can occur in both, and especially in people with learning disabilities and who lack social skills. Symptoms include an attraction to fire, purposely setting more than one fire, feeling excited or tense just before setting a fire, and feeling relief or pleasure in the aftermath of a fire. Causes. Although the exact cause is unknown, Pyromania is often associated with other psychiatric conditions, such as mood disorders, problems with impulse control, or substance abuse. People with pyromania set fires to release the buildup of an inner tension. The intent is not to commit a crime, seek revenge, or secure material gain of any kind. Kleptomania. What is kleptomania? Kleptomania is the recurrent inability to resist urges to steal items that you generally don't really need and that usually have little value. Kleptomania is a rare but serious mental health disorder that can cause much emotional pain to you and your loved ones if not treated. Kleptomania symptoms may include 1. Inability to resist powerful urges to steal items that you don't need. 2. Feeling increased tension, anxiety, or arousal leading up to the theft. The cause of kleptomania is not known. Several theories suggest that changes in the brain may be at the root of kleptomania. More research is needed to better understand these possible causes. But kleptomania may be linked to problems with a naturally occurring brain chemical neurotransmitter called serotonin. Serotonin helps regulate moods and emotions. Addictive disorders. Stealing may cause the release of dopamine, another neurotransmitter. The brain's opioid system. Urges are regulated by the brain's opioid system. An imbalance in this system could make it harder to resist urges. Kleptomania is considered uncommon. However, some people with kleptomania may never seek treatment, or they're simply jailed after repeated thefts, so some cases of kleptomania may never be diagnosed. Kleptomania often begins during the teen years or in young adulthood, but can start in adulthood or later. About 2/3 of people with known kleptomania are women.
Six types of eating disorders. Eating disorder is a psychological disorder or illness that is defined by abnormal eating behavior that rooted from environmental pressures and negatively affects physical and mental health. According to National Institute of Mental Health, a person may start eating less or more than usual. Then the habits spiral out of control. 5.4% of children between the ages of 13 and 18 will suffer from anorexia, bulimia, binge eating disorders at some point in their lifetime. Roughly speaking, that is more than 2.2 million adolescents. Anorexia nervosa. Anorexia nervosa is likely the most well-known eating disorder. It generally develops during the adolescence or young adulthood and tends to affect more women than men. Pica. Pica is another entirely new condition, only recently recognized as an eating disorder by DSM. Individuals with pica crave non-food substances.
Binge eating. People with binge eating disorder compulsively overeat, rapidly consuming thousands of calories in a short period of time. Despite feelings of guilt and shame over these secret binges, they feel unable to control their behavior. Bulimia is another type of eating disorder which involves a destructive cycle of binge eating and purging. Following an episode of out of control or binge eating, people with bulimia take drastic steps to purge themselves of the extra calories.
Rumination disorder. Rumination disorder is another newly recognized eating disorder. It describes a condition in which a person regurgitates food they have previously chewed and swallowed, rechews it, and they either reswallows it or spits it out. The best way to help people with eating disorder is to take them to a doctor because this is a huge problem. Some things you can do to that person is motivate them, telling them that they are in good shape